I've been working at Makerere University School of Public Health since 1995, which is close to 30 years. I came as a young man, as a young researcher in 95, and then started on my master's training in 96. And this was a small class of 12 people. Sadly, 3 have parted. So our cohort of 96 will remain only 9. But we used to sit and study in one small tutorial room of 12, accommodating 12 people. So infrastructure then was not such a challenge because of the numbers. We were few. We only had one program. We had the MPH program, which had just started in 1994.
When I became the dean, we had very few academic programs. We had few staff and very few projects. But even those few were not fitting in the building that you see as the School of Public Health. That's the only building that was there for the school, and we needed to expand.
When I was a student in the School of Public Health more than 20 years ago, the school had about 40 students in just one master's program, the Master of Public Health program, in addition to supporting the training for medical students. But today we have about 1,000 students.
And we have had a huge impact in increasing the human resource, both the quantity and the quality of human resource in Uganda. We have had amazing numbers, unfortunately, of epidemics. The School of Public Health plays a very significant role in managing this epidemic.
The training in this place calls for quite a rigorous engagement between the faculty and the students. But then if we are limited by the space of laboratories, if one cohort is doing, the other cannot be in position to engage and have their work in place.
Having constructed the School of Public Health back in Mulago in the 60s or 70s, and up to now is still standing, we have given the best quality on this job, with experienced project managers, experienced engineers, and experienced team that has worked on all the projects around town under local construction.
I'm satisfied with what we've done so far. I have a good team of contractors. I have a strong team of consultants that have been with me, sleepless nights, telephone calls at odd hours, just to make sure that we come out with a product that's pleasing to our client and to society at large.
We are especially excited that we are launching this auditorium at the time when the second phase of this construction is also taking shape. For those who are able to see what's happening up there, we are moving to the 4th floor of the main block for our construction that will accommodate lecture theaters, laboratories, library, and other space that's critical for our teaching and our research and innovations. This journey has been a collective effort. It's not just us. It's been everyone in the School of Public Health, and everyone.
It's been a very long journey, and still is, to be able to complete this particular infrastructure. We have opened up this auditorium. We still have a long way to go, but we believe, as our motto for Makerere University is, we are building literally brick by brick for the future.
When we presented a request to Parliament to provide the money to support the project, and we said this is the initiative of members of staff, the parliamentarians asked, are they Ugandans? They couldn't believe that a Ugandan can get money out of their pocket to build a public institution. I do hope that the Parliament of Uganda will honor its pledge, because they were really impressed that this was the initiative of the staff, and they said, but that is something we must support. So I hope that they will provide the resources for us to continue with the rest of the project.
Indeed, we look forward to the discourse, the scholarship, and the innovation that will take place in this new auditorium and facility, which will just be another chapter in the storied history and legacy of some of the innovation, research, and policy development that has been sampled downstairs. The Rockefeller Foundation is looking to continue on building on our decades-long partnership with Makerere University, and I'm excited to see how far we will go together.
I would therefore like to invite you to be part of this journey of building this building for the future, and therefore contribute to the quality and quantity of health professionals, not only in Uganda, but in the region and Africa as a whole.